Hi, it's Jessica DeMassa. Welcome to WTFL here at the HISA studio at HIC 2019. Joining me right now, I have Enrico Coiera. He is a professor of Medical Informatics at Macquarie University. Hi,
Hello.
Good to have you with us.
It's great to be here.
Okay, so I actually saw your talk here at HIC, and one of the slides that I liked the most had a quote on it. And so you had said in this slide that we are not designing algorithms, we are designing human-machine systems.
It's a mouthful, isn't it?
It is, but I have to ask about it. What do you mean by this? Explain yourself, sir.
Absolutely. So right now, everyone is amazed by AI and what it can do. People talk about the data we can get, how we can use machine learning to build algorithms that might diagnose better or suggest treatments that are better. But the point is that doesn't do much on its own. And the example I gave was thyroid cancer. So there was a fantastic machine learning system which now diagnoses thyroid cancer on ultrasound, better than human radiologists. And so people say, well, that's a great thing. That algorithm you built is great. But if you bring that to the real world, what's going to happen? Well, we already treat too much thyroid cancer. We already over-treat and over-diagnose. I think was it South Korea, they've had apparently a 15-fold increase in thyroid cancer.
Oh my gosh.
But no, they haven't.
They're just
over-diagnosing. And so getting better diagnosis, all that means in this case is that we're going to be treating people who don't need to be treated. So my point is that you actually have to look at the bigger context of the world, of the health system you're using, and then algorithms help us do the jobs we need to be improved better. But just as the big tech guys do, focus just on what you can do that's better than human, doesn't mean we're going to get a better health outcome. And in this case, with thyroid, we might end up hurting people because they get surgery they don't need or radiation they don't need.
So what do we need to do as technologists to make sure that we don't just, start bowing down to the algorithm and take it as all-knowing and all-powerful? What do we need to do?
Well, we just need to talk, don't we? We need to talk to the people who make the decisions, and that might be the patient, who I'm sure you've heard many times on your show, or the clinicians. And, it's not about even just talking to a bunch of them. It's going to be different wherever you go. So, if I'm a Google or an Apple and I've got a fancy new technology that might work well in Boston or might work well in Shanghai, it mightn't work in Sydney where I live, because our people are different, our health system is different, and it's the way you deliver care that shapes so much of what you do.
What do you think? I think that this is beautiful, and oftentimes I like to ask, where do you think technology is failing the healthcare system?
Yeah, look, I'm not sure it's failing. I think the tech we've got is fantastic. I think the failure is in connecting the tech to what needs to be solved. And the title of the talk I gave today was People, Ideas, Machines, and in that order. I'm re-quoting a famous American military strategist called John Boyd. And the point is that you don't start with where is tech good at. You start with what is the most important problem I need to solve now? And then you say, well, okay, is tech the actual answer, or is a piece of paper and a pen better? And if a piece of paper and pen is better, you use that. You just don't do the expensive tech thing. So I think the problem almost is that healthcare is in love with technology and kind of can't see the simple solution for the sexy and cool one sometimes.
Absolutely. I think someone I spoke with a little bit earlier today had talked about how it's fetishized, technology is in healthcare. Yeah. So how do we, I guess, especially those who are working in an innovation role, wherever they might sit, if it's a big healthcare incumbent or if it's in a startup company, how do they in their job, if they're working, with an algorithm, with AI, with that technology, how do they remain mindful of keeping the human piece of this included in their decision making as they're developing their products and services and as they're rolling them out?
So I don't think you start that way. I think you actually start at the beginning with the users and the services, and then you work backwards and say, okay, we've got some problems, Mr. Tech Person, where can, or Ms. Tech Person, can you help us solve X? That's the way I think it should happen. If you're in a startup and you're tech driven, you might be lucky and get somewhere, but the chances are you're going to hit a brick wall.
All right, weigh in for me on the big tech companies, the big ones from the U.S. coming into healthcare, because we're seeing them come in more and more, and everybody's looking at Apple.
Amazon.
Yeah, exactly. So I mean, as much as you want to see them solve a problem, I mean, they're leveraging their tech expertise to build a product that they're going to sell into the system. So I mean, what are your feelings about them coming into this space? And do you think that the way they're going to disrupt, the way that everybody hopes they'll disrupt, is actually going to be, could it be helpful, hurtful? What do you think?
Both.
Yeah.
So I think the good news is if you talk about an Apple or a Google, they're consumer companies. They know exactly what it takes to make a consumer like their technology, to use it and get value from it. So they kind of have gone through a journey where they just don't produce tech for its own sake, you know. So I think they are very different to a company like an IBM or HP, sort of the big old tech companies that worked in healthcare and had a very different perspective.
Yeah.
You know, these guys fail early, fail often, lots of prototypes. So I think they can bring a different appetite. Having said that, this is not an easy business. I have seen so many big companies come, spend a lot of money, and fail. So
why do you think that is? What causes them to fail?
it's because they think, well, we're smart and we're tech guys, we know how to fix it. And kind of the bro culture.
Oh yeah.
Yeah.
Yeah, we know them.
Yeah. So that just doesn't fit. And secondly, healthcare is local. So if I'm using technology for making a car, then factory is a factory. But you know, primary care in the US is different to primary care in Australia. Is different to primary care in Taiwan. And the way we do things, our work processes, what we value, what we pay for, is different.
Give us a sentiment then, a little bit of like a temperature read on the patient or the health consumer, how they feel about tech here in Australia. Like, give us kind of your weigh in. Just even yourself and your own experience.
Yeah,
are people excited? Yeah, make it up.
Yeah.
No, I think I'm curious. People outside of Australia are curious as to what's going on down here because we don't often make it. It's a long flight.
Yeah.
So what do you think? Are as far as like the healthcare consumer is concerned, are they interested in tech solutions? How do they feel about telehealth? How do they feel about getting care on their phone through an application? What are some of the things that are, I guess, at the forefront of the digital revolution in healthcare here in Australia?
So I think I'd start by saying Aussies, that's an Australian word for Australians, Aussies.
Thank you. That one translates.
are really strong early adopters of new tech. So a lot of companies see Australia as a great testing ground for new consumer technologies. And I think the appetite for healthcare is just there. But interestingly, I don't think our system is very innovative at all. I think for a lot of complex reasons, some which might be the same in the States, where you have a lot of vested interests who make their money out of keeping things exactly the way they are, makes it very hard to innovate in the healthcare space. And that makes it a challenge. And I think, you talked about disruption before. That's why people use that word. We need to disrupt the existing system. At which point I say, look, I'm not sure.
Yeah, no, I've heard that a lot.
Yeah.
I've heard that a lot.
Because, what I'm saying is we've got a system here that, people say, oh my goodness, 3 and 4% of people get harmed in healthcare. And some of my colleagues say, well, actually that means 97% get outstanding care. And in such a complex, difficult, messy world like healthcare, that might actually be the best you can do. So it's about understanding that we're actually already doing a great job under difficult circumstances, and rather than coming and telling us we can do a better job than you, come and tell us how you can make us do an even better job now.
Yeah.
Don't try and write us out of the equation. Make us part of that solution.
Yeah, it's complicated because especially I think. Well, no matter what, it's like the healthcare system has the consumer, it has the care delivery piece, and then it's got the person who's paying for it.
Yeah, exactly.
And whether it's a government or a health insurance plan, it's a triangulated, complex relationship.
Yeah.
So, okay, last thought for you, from a tech guy here in Australia, what are you interested in? Is there any particular technology that you're really excited to see being integrated into the healthcare system here in Australia?
So my big secret is I've been doing this for 30 years. And so when I started in AI, artificial intelligence, and it's kind of exciting that it's only taken 30 years for that to be cool. So I'm really excited now.
But you made it.
I made it. I'm still alive. I'm still breathing. I'm excited to see that people at last get how transformational it's going to be. I'm excited to see the huge interest from industry and really from everybody in doing it. And I think what I'm hoping is that we now have enough experience of digital health, electronic records, etc., and knowing how hard it was to make that change, that we don't have to go through the same pain this time. And I would love to imagine that, in 20 years' time, that we have a system that's smart, adaptive, effective, that puts us all in charge of our own care, that doesn't leave us behind, that gives us the absolute best, most modern care possible, and that is still human. That would be wonderful.
Yeah. That sounds great. Sign me up.
I'll have one of those.
Yeah, exactly. I'll have one of those. Sign me up. All right, Enrico, thanks so much for stopping by and speaking with us. It's a pleasure to talk to you. I'm Jessica DeMassa with WTF Health here at the HISA studio at HIC 2019. Thanks a lot for joining us.